Good afternoon. My name is Eleanor Bryant and I'm part of the United Kingdom Acquired Brain Injury Forum's Special Interest Group for Wales, Amsterdam Newid Cymru. And I've been involved in a collaborative piece of research exploring educators' knowledge and understanding of brain injury amongst UK educators. Just to give a bit of a UK context, so prevalence rates remain sort of largely unknown, but it's estimated that at least 40,000, apologies, that's gone forward, 40,000 children each year sustain a brain injury, which can impact on learning and educational outcomes, necessitating increased support. So UKBIF have called for improved educational support for children and increased awareness amongst educators about brain injury through better training provision. And research evidence shows that parents face significant challenges in accessing support for their children, and educators sort of report that educators frequently misinterpret behaviour of their child, often around some of those hidden aspects of brain injury. So the aim of our research was to look at educators' knowledge and understanding of brain injury, as well as their confidence levels in supporting a child with brain injury across a range of professional roles and across a range of school settings within the UK. Sorry. I won't go into too much detail here, but just to say we had 3 broad themes that we looked at in terms of the questions that we asked, and this was conducted as an online survey across a number of months. In terms of our educators, we collected data from educators who are based across all 4 UK nations, although predominantly from England, and they had a range of experience, which ranged from just starting out in education up to 45 years, so quite a high level of experience among some of our educators. And in terms of professional roles, we had a range of roles represented in the survey, and also in terms of school settings, primarily from primary and secondary education. So the first question we asked was an open-ended question: what does the term ABI mean to you? And we had 3 key take-home messages from these findings. The first, that educators had a very generalized understanding of brain injury, that it is an event that occurs after birth, and words which thematically related to traumatic brain injury cropped up more frequently in the word analysis compared to other types of brain injury. And this is very much supported with some of our sort of follow-up questions that we asked as well. And in terms of consequences of brain injury, educators only really pointed to cognitive consequences, which only cropped up on a number of the word counts. We also looked at the support that educators provided to children and also some of their training experiences. And quite a good proportion of us, sort of nearly 60%, had supported a child, although when we asked sort of how many children they'd supported, around half had only supported 1 child, and then up to 80% between 1 and 3 children. 42% of our sample had undertaken training. It was a sort of a tick or the apply type question. A lot of the training would tend to be self-directed, so research on sort of internet, fact sheets, that kind of thing, and some of it provided by specialists, so charitable organisations, or to support return to education, so provided by hospital. Only 6.6% of our sample had undertaken training as part of their initial teacher training, and the main motivation that educators gave for undertaking training was to support a child returning to school. So very much a responsive approach to the training. When we looked at those who had supported a child, they were more likely to have undertaken training, although there was a significant training gap in that nearly 1/3 of those who were supporting child did not undertake any training, although there was some variability by role. We surveyed knowledge, and we used questions that have been used in previous research, and we looked at confidence. So these are our own generated questions. And we found that knowledge varied according to domains. So there was better knowledge around around sort of recovery, items relating to recovery and rehabilitation, and there was greater uncertainty around areas such as how they communicated with other agencies or sort of medical understanding. In terms of confidence, overall, most of our educators didn't feel particularly confident in supporting a child. And when we looked at what influenced confidence and what influenced knowledge, we found that those who had supported a child with brain injury, those who were working in special educational needs roles, and those who had undertaken training had better confidence and better knowledge of brain injury, although confidence still remained low across all three groups. It just wasn't quite as low. We also asked questions about school policies. So we asked if educators had any concussion policies within their school, and there was a huge amount of uncertainty amongst our group. When we asked follow-up questions to the educators who said they did have policies, they tend to be very, very general, so accident books, rather than specific ABI policies. And there's a similar pattern here when we looked at admission policies. We asked, do you ask any questions about brain injury during admission or on admission forms? Most didn't think they did or were unsure. And those that did tended to be, oh yes, we provide medical forms. There was one example in here which I thought was quite nice, where one person who had a background and understanding of brain injury said that they were very proactive in their school at screening for brain injury, and as a result of that, frequently identified children with brain injuries within their school settings, but this was very much a unique example amongst our sample. So just drawing it all together, so some of the key findings is that in our sample, educators seem to hold a very generalized view of brain injury, and their confidence levels across all the questions we asked relating to confidence were very, very low. And that included asking questions about sort of identifying signs of brain injury in the classroom, how to access information, resources for brain injury. So they lacked confidence on all those. In terms of training, the approach tended to be very reactive rather than proactive, so very much in response to a child returning into their school. And there was a lot of uncertainty in our sample about policy implementation. So in terms of sort of recommendations to take forward, to work more at sort of that early career level with teachers, so in that initial teacher training, obviously we saw that very few teachers had undertaken training at that level, and looking at what are some of the better practices around policy implementation and how can we get our resources that we develop into schools and make sure they're more visible to educators.